Every perfect storm begins with a breach. In chronic inflammation, that breach starts at your body's barriers, your gut lining, your skin, your sinuses, your more intimate mucosal membranes. These barriers are supposed to keep you safe, but when they fail, everything changes. And today I'm going to show you exactly how this barrier breakdown happens, why it triggers to systemic inflammation, and what you could do to start repairing it. Hi everyone, Dr. Kara Wada here, quadruple board certified allergy, immunology, lifestyle medicine physician. I'm also someone who lives with autoimmune disease myself as a Sjogren's patient. And I've dedicated over 15 years of my career to helping people with complex immune system conditions. I deeply understand the journey of living with a body that often feels like a complex puzzle. So this is episode 2 of the Perfect Storm series. If you missed episode 1, you can find it linked. And before we dive into today's topic, I want to make sure that you have something practical to take with you. I created a free tool called the Immune Confidence Storm Tracker. It is your 4-hour roadmap to recognizing your inflammation triggers and calming the storm. Simple self-assessment tool, take about 10 minutes to use, and it'll really walk you through all the teaching we're doing in this 5-part series. All right, so let's dive in. In our last episode, we introduced the 4 forces that create the perfect storm of chronic inflammation: the breached levee, the shifting winds, thunder and lightning, and the stalled pressure system. And today we're focusing on that first force because everything else flows from here. If you haven't watched episode 1, I'd encourage you to go back and watch it first. It'll give you the full context for why barrier breakdown matters so much. But if you're already here, you're ready, let's talk about the levees. Your body has several protective barriers. Think of them like levees designed to keep your inner world calm and your outer world mostly out. Your important ones are your gut lining, your skin, your respiratory tract, your sinuses, your lungs. And we don't talk about it as much, but for women, our genital urinary tract is in there as well. These barriers in many places are only one cell layer thick, particularly in the gut. And that one layer of cells stands between the contents of your intestines and your bloodstream, or the air in your lungs and your bloodstream. These cells are connected by what we call, at least in our gut, tight junctions. They're little protein structures that act like gates, carefully controlling what gets through and what stays out. When everything is working well, nutrients get absorbed and everything else stays out. But here's what many of my patients experience. They've been under chronic stress for years. They've had multiple courses of antibiotics, maybe even dating back to when they were itty bitty. Their diet has been heavy on ultra-processed foods because honestly, they barely have time to breathe, let alone cook elaborate meals. Or in my case, I feel like my generation, we were brought up on Pop-Tarts and grilled cheese sandwiches and Doritos. They've had recurrent infections, poor sleep. You get the picture. All of these factors can damage those tight junctions. They make the gates loose or leaky. That's what we call increased intestinal permeability, or many times you'll hear it referred to as leaky gut. Once this happens, things that should typically never enter your bloodstream start making their way through. So let me get specific about what happens when your gut barrier is breached, because this is where the science gets critical. When your gut barrier is compromised, bacterial products, particularly something called lipopolysaccharide or LPS, can translocate across the barrier and into your bloodstream. LPS is part of the cell wall of certain bacteria, and your immune system recognizes that as a major threat. The moment LPS enters your bloodstream, your immune system sounds the alarm. It activates innate immune cells like macrophages, dendritic cells, and these cells release inflammatory cytokines, interleukin-6, TNF-alpha, interleukin-1 beta. This is how a local gut problem becomes systemic. It's not, though, just bacterial products. Partially digested food proteins can also cross the barrier. And your immune system can see these as foreign invaders, especially if they're larger protein fragments that shouldn't be there. So this can trigger both innate and adaptive immune responses. And in some cases, it can even trigger the production of autoantibodies, antibodies that mistakenly target your own tissue. In research on lupus, for example, bacterial translocation from increased intestinal permeability is directly linked to increased immune activation and autoantibody production. Now, the gut gets most of the attention when we talk about barrier dysfunction, but the same principles apply to your other barriers. On the skin, barrier breakdown allows toxins from bacteria like Staph aureus to penetrate. These toxins can act as what we call super antigens, meaning they provoke a massive system-wide immune alarm. This is a key mechanism behind chronic inflammation and eczema and why people with eczema often have other immune system issues. In the sinuses, chronic inflammation damages the mucosal barrier, allowing bacterial toxins to enter and perpetuate the cycle of chronic sinusitis that so many of my patients struggle with. And here's what's really important to understand. These barriers often fail together. If your gut barrier is compromised, there's a good chance your skin or sinus barriers are also struggling. The storm has made landfall on multiple fronts. Now, if you're dealing with Sjogren's, or if you suspect you might have an autoimmune condition, you have a family history of autoimmunity, this barrier breakdown is especially significant. There's actually a theory in autoimmune research called the epithelial barrier hypothesis. And this also comes up in the discussion of allergy and the development of allergy as well. It suggests that barrier dysfunction may be one of the earliest triggers in the development of autoimmune and atopic or allergic disease. So here's the sequence. First, your barriers become compromised, either due to genetic factors, environmental triggers, stress, diet, infections, combination of all of the above. Then antigens and bacterial products start crossing those barriers. Your immune system responds, as it should, with an inflammatory response. And over time, this chronic immune activation can break down immune tolerance or your body's ability to distinguish self from non-self. And once tolerance is lost or broken, autoimmunity can develop. This is why I get so frustrated when patients are told their symptoms are just stress or just aging or just perimenopause. Yes, stress plays a role. Yes, hormones play a role, but there are real, measurable, biological mechanisms at work here. And the good news is, we can address them. So this brings us to the first R of the immune confident framework, recognize. We can't calm the storm until we identify where your levees are leaking. So how do we do that? Well, first, we get a really thorough clinical history. What are your symptoms? We look at your life experience. What are you experiencing? Are you having digestive issues, bloating, gas, irregular bowel movements, foods that you just can't tolerate anymore? Do you have chronic skin issues? Eczema, rashes, psoriasis, hives? Do you have chronic sinus congestion or history of allergies? Do symptoms flare after eating a particular way or visiting a certain environment? These are all clues that barrier dysfunction might be a part of your picture. We also can look at some targeted lab testing. We might look for certain inflammatory markers that suggest systemic immune activation. Sometimes these can be subtle. It could be a mildly elevated level of your platelets, or we can see that you're having trouble absorbing vitamins like iron, low ferritin levels, vitamin D levels, which also can contribute to increased gut permeability. We also look for pattern recognition. And here's what I want you to understand. This isn't just about one lab value or one symptom. It's about looking at the pattern as a whole. When I work with a patient, I'm looking at the full picture, the timeline of when the symptoms started, what triggers made them worse, or what things made them better, what other symptoms were affected. That's how we identify your unique storm pattern and figure out where to start. Now, before we wrap up, I need to point something out. A breach in your gut barrier doesn't just happen in isolation. It's often a sign that your local microbial ecosystem or your microbiome is already out of balance. After all, those beneficial bacteria in your gut actually help maintain your barrier integrity. They produce compounds that strengthen those tight junctions. So when dysbiosis sets in, when the shifting winds blow through, it's not only triggers inflammation directly, but it also weakens your levees even further. So you can see how these forces feed off one another, and it's really short-sighted to look at them on their own. That's exactly what we're going to explore in the next episode. But here's my question for you today. Have you ever felt like your gut instinct was like spot on? Your symptoms started when your immune system barrier broke down, maybe after a bad infection or a period of an intense stress, after a catastrophic accident, or you kind of went off the deep end with a particular style of eating. I want to hear your story. Drop it in the comments below. And if you want to figure out whether barrier breakdown is your primary force, download my free Immune Confident Storm Tracker, your 4R roadmap to recognizing your inflammation triggers and calming the storm. It's a 10-minute self-assessment that will help you identify which of the 4 forces is most active in your storm. The link is in the description below. If you're finding this series helpful, please hit that button and subscribe so you don't miss the next episode. In episode 3, we're diving into the shifting winds, the microbiome, dysbiosis, and exactly why rebuilding microbial balance is so critical for calming that immune storm. In this episode, we talked about the breached levee, those barriers that have broken down and need repair. And here's what I know. Recognizing where the breaches are is just the first step. But recognition alone isn't quite enough. You need a roadmap, a plan, and most importantly, a vision of where you're going. This is why I created the vision map we'll be building together in the Reclaim, Rebel, and Rise workshop on December 4th. This isn't just a vision board exercise. This is a structured, science-backed framework that helps you release what's been holding you back, the inflammation patterns, the old stories, the survival mode you've been stuck in. Envision what you actually want for 2026, not what you think is realistic, what others expect, but what you truly desire. And anchor that vision in actionable steps using the 4R framework. So it's not just a dream, it's a plan. I've watched so many brilliant women stay stuck in the storm because they lose sight of what's possible. They become so focused on managing symptoms, on just getting through the day, survival mode, that they forget that they're allowed to want more and to dream bigger. This workshop is permission to dream again. We're meeting live on Thursday, December 4th. It's free for members, $26 for everyone else. And here's the thing, even if you can't make it live, everyone who registers gets the replay and the vision map template. I really hope you'll join us live. There's something powerful about doing this work in community in real time. The registration link is in the description. I've kept it intimate, limited spots because I want to be able to engage with everyone who shows up. If you've been feeling like 2025 was the year of just surviving, let's make 2026 the year that you start thriving. Register now, and I can't wait to see you there. And don't forget to pick up your storm tracker too. Both of these tools work beautifully together.